Hello, and welcome to the Aging Answers podcast. I'm Rob Faubion with Age of Central Texas. We are your regional nonprofit organization that supports older adults and family caregivers. And every month, we bring you the Aging Answers podcast with experts to help you with great information that can help guide you during your aging and caregiving journey. Our Aging Answers podcast is brought to you by HEB because no store does more for older adults and family caregivers in Central Texas than my HEB.
You know HEB for quality fresh food at low prices to help you eat well. Now, HEB has primary care physicians and dietitians on staff to help you get and stay well. And because HEB believes affordable care should be accessible to all Texans, monthly memberships and cash payment options are available. Let HEB's team of highly reputable and experienced care providers help you on your health journey. Virtual and in-office visits are available. Visit heb.com/wellness to learn more today.
This month is National Long-Term Care Planning Month, and it's also National Self-Care Awareness Month. So joining us today is Bonnie Howe, who is the Program Director for AGE's Resource and Information Center. Hello, Bonnie.
Hi, how are you today?
We're doing fantastic. So glad that you could join us. Today, we wanted to talk about some of the questions that we get asked the most here at Age of Central Texas, that caregivers and older adults come to us seeking information to help them in their journey. Before we start with questions, though, Bonnie, you have to tell me about that stuffed animal that is on your shelf behind you.
Yeah, that is my color monster. There's a great children's book. I love children's book. I find we learn so much and just I can spend hours in the bookstore reading kids' books. There's a great book called The Color Monster, and every monster in the book is a different color and represents some kind of an emotion. And that green monster with that sweet, sweet smile is the calm monster, the one that is just calm and serene and everything is great. And I find for myself in this role here at Age, I need to be the one who's the most calm presence in the room or on the phone, because a lot of caregivers and older adults call me when they're in this state of panic. And something, a trigger has happened and they need to make a change or make a decision right now and they're overwhelmed. So I like to be the least anxious person in the room, the least anxious person in the conversation, the sense of calm. So I love that little green monster.
And that is so appropriate for today's conversation because we're going to talk about some things that most people tend to freak out about as we're aging, and rightfully so. And of course, I think one of the biggest questions that we get all the time has to do with housing.
Yeah.
As we're aging, and what do we do? Do we stay in our home? Do we move into a community? Do we move in with our family? What is our trigger for that? So let's talk about that. What are some of the things we need to know? And what are some of our options that we have as we're aging?
Yeah, I think the most important thing that I would tell people right off the bat is to actually think about it and talk about it with your friends and family before that trigger happens. Because if you're thinking about what happens if I have a fall and I'm unable to live by myself anymore? What happens if I have a stroke and I need to make a decision about living? By proactively thinking about those things, you actually give yourself a lot more options and choices. So, for example, if I was to be let's say I'm retired and I know I've had some little bit of health issues and I start thinking about different communities or different situations that I think I would enjoy. If you look at those sooner rather than later and plan that out, then you can tell your family, look, I've done the exploring and I think I would be really happy at this community, or I'd really be happy staying in my home, but I know there's some things that need to happen for me to do that. So putting those plans in place, or just even having that general conversation first, gives you a lot more choice. If you have something catastrophic happen, like a stroke, or you're in an auto accident and you have a significant health issue, you're limited to what's available, what has beds right now. Those decisions of, oh, I've got to go live with my daughter in Dallas or whatnot, those things happen quickly and you don't get much say in those decisions. So being proactive is a key component of thinking about long-term housing and choices. But then once you start thinking about it, there's so many different options. You mentioned staying in place. People want to stay in their homes, they want to stay independent, but sometimes there's things that you need to think about changes in the house. Maybe you're in a two-story and your bedroom is upstairs, but if you want to stay long-term in your house, now is a great time to go through that pain of making a remodel or a renovation so that you can change that front office into a bedroom. You can expand the doorways to accommodate wheelchairs. You can install the grab bars and things that you need now when you have the time and the energy to live in the midst of a renovation, right? So those kinds of things are something to think about when you're thinking about staying in place. And then there's so many options beyond that, right? We work with a lot of different entities and organizations, assisted living communities, independent living communities, and that can be a real challenge to navigate.
Yeah, it's so true. Studies have shown that 90% of all older adults want to be able to stay in their home, which makes perfect sense. But in order to do so, you need to think ahead of how am I going to be able to navigate this home as I age?
Yeah.
I've mentioned many times on these podcasts that I'm caregiver for my parents and they're aging. Their home was built in 1980 and it was not built for folks to age into. And so we've had to do quite a bit of renovation on the home so that they can continue to stay there as health issues continue to happen. And that is so true that you need to think about it sooner than later because you don't want to be coming home from a fall at rehab in a wheelchair and realize I can't get to the bathroom.
Mm-hmm.
And so that is so true. And as we've always said, staying in your home is great until it's not.
Yeah.
And so we're often asked, what is that trigger that tells me, okay, I really should not still be living in my home? So what
Yeah.
do you often tell families and caregivers?
I just had a conversation with a lady in my circle of influence in my church, actually. And she's vibrant, active. She's in her late 80s and she still lives independently. And for her, she said, you know what? I'm tired of all the housework and I'm tired of, I don't actually do the yard work, but I'm tired of having to think about it and plan for it and worrying about the trees if it rains or freezes. I'm just tired of that. And maybe it's time for me to move to an independent living community. And so for a lot of people, it could just be I just don't want to think about this anymore. For her also, she's a single woman. And she said to me, and cooking, I'm so over it. That was her word. I'm so over it. And independent living facilities or communities, we like to call them communities, they have different kinds of community, whether you have an independent apartment where you have a full kitchen to that place that provides meals during the day. Some are one meal, one main meal, some are both or all three meals. You have the continental breakfast. So there's a lot of different variety. But for a lot of people, it's just, I'm tired of this. I want to just enjoy life and not have to think about these chores I've been doing for so long. For other people, it's a health condition, a diagnosis of Parkinson's or a stroke, dementia symptoms, those kinds of things. A fall, if you've been falling often and you just want a little bit of extra support, that can be a trigger. Another thing is medication management. For some people, there's just so much going on with their medications and they wish they had a little bit of oversight. They're feeling like maybe it would be safer for them to have somebody checking in on them more often than not. And that can be a trigger as well. I wonder what triggers you've experienced, Rob.
Yes, as you mentioned, I think the big one is safety. When it's no longer safe for you to be living by yourself or with your spouse in your home. Falls, most definitely. If you're having falls often, that's a safety issue. You want to be somewhere where you can get that support. Medication issues, none of us have one doctor and one set of pills. We have multiple doctors and lots of pills. And often as we're aging, those medications cause other problems. They do cause falls. They cause hypertension. They cause lots of things that we could use some assistance with. And as you said, it's socialization. Living by yourself
is lonely.
Is very lonely. It is. And we know that one of the things that helps with cognitive health and also with physical health is socialization. Even before the pandemic, the CDC said that isolation among older adults was already at a pandemic level, and that the harm that it causes your body, your physical body, is the equivalent of smoking a pack of cigarettes a day.
Yeah.
And it will break down your body because it breaks down you physically and mentally. And so just being around other people and having social events and activities and being able to go places and do things with other folks is very important. So,
my grandmother, if I might interrupt, my grandmother, she didn't drive. She lived in the same small town. She immigrated from Italy to a small town in Canada, got married, raised her kids, lived there her entire life. And when her kids were young, she was engaged in the community. But as she got older and less mobile, her world really shrunk. And it came time where my grandfather said, I think you need to move into a community. And so together they decided that. She moved into community, and it was so much fun because all of a sudden she was with all of these women that she had known since she was a young woman, since she had raised kids together, but they had lost contact even though they lived only blocks apart from each other because they were not mobile anymore. And now they're all living in community, and she had a blast. She lived to be 103, and they had so much fun together. It was great. It was a real
same with my great grandmother. When I was born, our families had ranches here in Central Texas, and they were all next door to each other. And in 1970, she decided, I am selling my ranch and I am moving into a community where all of my friends are. And she lived there for 30 years with her friends because she didn't want to be stuck out on the ranch by herself anymore. Yeah. And so that's so true. So let's say we've decided we need to move either for safety or for community, and we're sick and tired of keeping the house and cooking. We're going to move from the home. There are so many choices and so much to look through and all of that. And you've got independent living and assisted living and memory care and skilled nursing. How do we navigate that? Is there anybody who can help us navigate all of those choices?
Yeah, I really, really am a strong advocate of using a senior living advisor. And we have a number of them that we have connections to, we refer out to, and I've got great feedback. I really value feedback that I get from people that I speak to and refer to. So that's really important to me. But a senior living advisor is such a great resource because what they do is they sit down with you and your folks or your husband and wife, and they do an assessment and they say, what's important to you? What kind of community are you looking for? Are you the type of person who wants to have a lot of outings? Are you the type of person who likes to swim every morning? Because a lot of communities now have pools, so they have fitness facilities. Do you like to engage in activities, games, that sort of thing? Do you like an afternoon happy hour? So those kind of things they ask you about. They also ask, would you like 3 meals a day? Do you need medication management? What kind of needs do you have? And then they take all of that information as well as what your financial picture looks like, and they will go out and navigate for you, investigate for you. They'll come back and say, you know what, I've got 3 or 4 places that I think would be great fits. Why don't we go tour them? And so they'll take you out on tour with you. They'll ask all those questions that you don't know to ask. about the chef service and the housekeeping and all of those things. And they can also help you navigate the enrollment or application to get into that community. So they're really, really great resources. Another thing that I find about them is you don't pay them, they get paid on the back end. Because I think it's important that you understand how they're paid for their services, because they are providing a service. So a number of them will have contracts with a number of communities, right? But I was recently speaking with a senior living advisor who said, you know what? We're only getting paid from about 20% of our placements because it's not important to us that we get paid. It's more important to us that you are in the community that suits you best. So we're looking for people of integrity when we make those referrals. And that's the kind of thing that I really appreciate about the people that we have connections with, is they're doing it to be of service with servant hearts. And yeah, they're not necessarily in it for the money. They're in it to be of service. So I like that about them too.
Yeah, most senior living locators and advisors have been in the industry before, and they've had family members that have tried to navigate it themselves and realize just how complicated it is.
Yeah.
And so they work like an apartment hunter for you.
Or a
Same
realtor.
way. Yeah, same way. And so there's no cost to you for their service. They get paid from wherever you are placed. They get a commission from that. And so they are usually the most knowledgeable people in your community of knowing all about, these are the best places to stay and what will suit your needs, specific needs, the best, because they know those communities inside and out. And so they'll know all the little nuances that will make it the best fit for you.
Yeah.
Now, you mentioned finances, and that's always another big question we get asked is, how in the world am I going to pay for all of this? Because it is very expensive to find housing. We may own the home, it may be paid off and we sell it, but do we have enough money from that sale to be able to find something else? So I know that we always talk about certified senior financial planners who can help with trying to figure out how do we financially survive the last part of our life. Talk a little bit about what a certified senior financial planner is and how they can help in this process.
Yeah, so there's a lot of great resources in senior financial planning. There are people who are certified retirement counselors. There are people who are certified senior advisors, financial planners. So there's a lot of different designations. But in essence, what they're all trying to do is provide very specialized financial planning services and advice that help older adults meet their needs long term. They help do things like estate planning. They help put into place trusts and that sort of thing to protect assets, or to make you more easily ready to apply for Medicaid, for example, because for skilled nursing community, you want to be on Medicaid. And so that can help you get into a place and pay for those places because they're pretty expensive if you need skilled nursing. But senior financial planners or certified financial planners know the ins and outs and how to get you looking the best for applications. They know how to protect those assets, and they know how to tap into assets that you might not think about. So the equity in your home, that sort of thing. So there's a lot involved with all of that, far more than I know. But that's why I tell people definitely connect with a certified financial planner. It might cost you a little bit to have that service, but it's going to save you so much in the long run.
That is so true that it's worth the cost. I'm dealing with that with my parents currently, and I have taken them to a financial planner who's certified in senior care for that very reason. And, little things that we never thought about, that we thought we had all of our bases covered. We had been working on this for quite some time. And I thought we were in a really good place. And there are little nuances with the laws, and Texas especially has all these weird laws that we never even thought about that would have blown up our plan in an emergency situation, that it would not have gone the way that we thought it would have. And
Yeah.
so knowing that and being able to make those adjustments has been huge,
Mhm.
because now we feel like, okay, we really are in a good place.
Mhm.
And, most people don't have a lot of money when they retire. They don't feel like they have a lot of equity when they retire. And so they're very worried about, what am I going to do? And the planners can help you look at, okay, you actually have more equity than you think you do. You've got some life insurance policies. Okay, there's equity in that. You've got home that, even if it's not fully paid for, you've still got equity in that
Pretty
home.
nice.
You have things, so we can take a little out of this and a little out of here and a little here and a little here. And before we know it, we've got a basket full that we
Yeah.
can utilize without having to sacrifice everything that we have. And it's having someone that can see it from the outside, who has that expertise and knows the ins and outs. Medicare is a booger. Medicaid is even worse.
Mhm.
Having someone who's an expert that can help you prepare for that is so important. And let's talk about that for a second, because trying to navigate Medicare, Medicaid, as you mentioned, if we're
Social
looking
Security.
skilled, if we're Social Security, veterans benefits,
Mhm.
we have those as options to help us financially, but they're not going to pay for everything. And trying to get all of that set up in advance is so important, because you don't want to try to figure that out when you're leaving the hospital or the
Right.
rehab. So who can we look to help us get ahead of the game for those?
So I really think those certified financial planners are the best bet. There are some really great resources right now in the community though that are low cost that could also be a really great option, particularly for benefits like Social Security benefits, Medicare, Medicaid. One of the nonprofits that we work with a lot is Foundation Communities. And Foundation Communities recently got a big grant. And so they have trained a bunch of volunteers. They've gotten them certified. Many of the volunteers are lawyers and accountants. And so they have opened these Prosper Centers, or they've really developed their Prosper Center program. So it's very robust. There's two locations, one in the north part of the city, just off of Airport, and one south. And they are fantastic resources. I have been so impressed with what they're able to do and how they're able to serve older adults. They specifically got this grant to serve older adults, so they've done a lot of good work with that. And not only navigating Medicare, Medicaid, Social Security benefits, which I have recently learned so much more about Social Security that I had no idea. So I would encourage you to reach out and talk to somebody at a Foundation Communities Prosper Center, just even to have them kind of walk you through some of the things, because you might have had a change in your situation that you didn't know, then now you qualify for extra Social Security benefits, or that now you've changed and you're able to access a different Medicare supplement plan, that sort of thing. They also do tax preparation. And one of the things they've been really passionate about is having a look back at the last couple of tax returns you've done, because they have discovered that so many people, especially older adults, are leaving money on the table. They're leaving it in the hands of the tax man, and they want you to get that money back. So they're doing all of that at no cost. So I really encourage you to check them out. Another great resource is the Capital Area Aging and Disability Resource Center. They have a new philosophy, or maybe it's an old philosophy, of no wrong door. And so you can just call their toll-free number and get connected to a navigator who will help you figure out resources. So that's a great expert advice line too. So you can check with them as well. But those two things are really, that's what I've been giving out so much information about lately, is those two great resources.
And of course, we also often mention the Area Agency on Aging, that their benefits counselors are fantastic resources for Medicare, Medicaid. They can assist with that. They are the pass-through money of the Older Americans Act. So they are your tax money already paid for. They're absolutely free. And they are not selling insurance. They are just helping you navigate it. And so they have no dog in the hunt. And so they're a great resource. And as we've mentioned that there are area agencies on aging throughout the entire U.S. So if you're joining us on this podcast from somewhere other than the Central Texas area, you have an area agency on aging that serves you. Just Google area agency on aging and your town or zip code, and it'll tell you which one serves you. And again, all of their services are absolutely free because it's federally funded. We also often talk about geriatric case managers. This is something that a lot of older adults and caregivers don't know about, that it is a profession that's been around for a very long time. Tell us a little bit about what a geriatric case manager is and what they do.
So, geriatric case managers, I always tell people first and foremost, look for aging life care managers. So, there's a designation, a certification. It's called aging life care managers. And that's what we tend to look for when we're referring people to geriatric case or care manager. Now, they'll do an initial assessment with a family or a couple or a person and say, okay, let's look at where you are right now, what health conditions you're experiencing, what that financial picture looks like, what your insurance picture looks like. And they're going to say, you know what? Probably this is what's going to happen in the next 5 years, and this is how you can be best prepared for it. I've talked a lot about geriatric case managers with my adult child caring for a parent support group, because we as adult children caring for parents, we really think we have to do it all and we have to navigate it all and we have to find all the answers. But you could spend 6 months on the phone trying to get one referral to one specialist. And it can be very frustrating, especially if you are also caring for children, working a full-time job. You're trying to also have some kind of social life and take care of yourself. So all of these things, but to spend 6 months on the phone trying to get into an appointment, it's so well worth the consultation and the money that you might spend. And it's not that unaffordable. It's not that expensive to reach out to them. They really help serve as a guide. They can offer suggestions and create a plan. Remember when we first talked at the beginning about being proactive? They really help you be proactive. The other thing they can do that I think is important is they can help that communication. If you are part of a family and everybody's got a stake in the game, everybody thinks they know what's best for mom and dad, or maybe you're an older couple and you're trying to make decisions for yourself, and then your kids are in the background going, but wait, what about, I think this should happen, and all of that. And geriatric case managers can act kind of as mediators. They can help you all get on the same page, which I think is very helpful. Still doing that with a very objective view, because they don't have an emotional connection to it. So there's so many positive things to using a geriatric case manager or care manager. I think it's well worth it, very much well worth it.
And as you mentioned, everybody's journey is different, but
Mm-hmm.
we all have the difficulty of finding resources and knowing what we should be doing next, and we'll bring family dynamics into it and the emotions of all of that, and suddenly it just becomes a very difficult situation. And that's why Age of Central Texas has Bonnie Help, because it's somebody who can help you navigate through all of that. Bonnie, tell us just a little bit about what your job is here and how you are so important for helping families and caregivers.
So, as the program director for information and resources, I receive phone calls, emails, people walk into my office, and I get those questions of, My mom had a stroke and now she is supposed to be coming out of rehab. And I just met with the social worker and they said she can't live on her own. And is she coming to live with me? I don't know that I can do that. What do I do? How do I navigate this? So I field all of those calls. As I said earlier, I like to be the least anxious person in the conversation, to listen. A lot of times people know what they want to do, but they're having a hard time figuring out how to do that. What's the best next first step? And so I kind of create a packet of resources. I curate a list for people of, you might want to make this phone call first, but here's a couple of different people who can fill that need for you. I do also like to make sure that people know that if they call one person and they don't really click with them, there's another person to call. So I want to make sure that they know just because I've given you these 2 or 3 resources doesn't mean I don't have a whole lot more. So I do definitely like to have follow up with people. I also facilitate support groups. We have a number of support groups that are connected to age, and I know of a number that are in the community. So if you have a particular need or you want to talk to somebody in person, I can get you connected to support groups and mental health professionals. I also like to provide seminars. So AGE does seminars and I am helping to organize those. And I do speak out in the community and share resources out in the community. And I also teach some classes through our Caregiver U program. So I feel like I got a lot of hats. And today I'm the health equipment lending program person too. So I'm just here to jump in and help wherever I can, wherever I'm needed. And I try to do that in a very timely manner because I know time is of the essence when you're a caregiver.
And as a family caregiver, I've said this before, nobody ever teaches us how to do these things, how to navigate these resources, how to provide the care. And often when our journey changes, it changes drastically.
Mm-hmm.
And we just don't really know what to do next.
Yeah.
And so having the Age of Central Texas Resource and Information Center there as a free for you to access many times as you need it resource to help guide you is so invaluable, because not only is it the timely info that I need now on making these decisions so that we can keep moving forward, but it's also the hand on your shoulder saying, hey, you've got this and I've got you.
Yeah.
So that's so important. 2 more quick questions for you, Bonnie. What keeps you up at night?
You know what's keeping me up at night lately is I've been getting so many phone calls from older adults who retired 5-6 years ago here in Austin area, and they planned well, they prepared well, and now that plan is not working because the cost of living has gone up so much in Austin. So I've had a number of calls in the last few weeks of older adults retired who are being evicted from their homes, from their apartments, that sort of thing. And that's keeping me up at night because that system of affordable housing is really a challenge, as we all know, and we've all heard here in the Austin area in Central Texas. So that's keeping me up at night, and transportation is keeping me up at night as people can't get to their doctor's appointments and so on because there's not really good transportation that covers all of Central Texas. If you're in Austin, it's great. If you're in Austin proper, but if you happen to live outside of the Austin city limits, or you're not in Round Rock city limits or Pflugerville city limits, it's a challenge to get to places and get to doctor's appointments. So that's a challenge for me. Those 2 things keep me up at night for sure.
Those are the same for me as well. When I speak in the community, those are the questions I get asked the most. And, people will tell you their stories of their struggles, and it's so hard when you don't have a good answer for them.
Yeah.
And, Austin is getting better. We're getting better at as a community in our services, but we still are way behind in being where we need to be for service. So I understand that. Let me flip the coin. What is the most rewarding thing for you working here with Age and serving older adults and caregivers?
I love when a referral goes well. So, for example, I have an email that I received recently that I've kept by my side that shares about a family that mom was being moved from another state to come here. Daughter is a little bit older as well, and they were trying to find a place where they could live together in a community. And so I gave them a couple of referrals for senior living advisors, and it took days, just a couple of days, and they were able to find a place. And the email talked about how when they finally found the place that was the best fit for them, they were both crying about how this was going to be their home, and they were so grateful to have found a home together. And I loved that. That just, when those things happen and it seems like everything falls into place, and that's really rewarding for me.
Now, when you can provide that solution to the problem
Yeah.
and give them their life back.
Well, and they
And
talked about having hope for their future.
Mhm.
And I think that's really, really powerful. Hope for their future.
That certainly is. And I want to say I thank you very much for all the wonderful work that you do and all of the great resources that you have at your fingertips, because as caregivers and older adults, a lot of times we just don't know where to look for those. And having that one stop to be able to find them is fantastic.
Mhm.
Bonnie, thank you so much for spending the morning with us, sharing all of this great information. We so appreciate that. And we appreciate you taking your time to join us for our Aging Answers podcast. Remember that we are here every month with a brand new Aging Answers podcast, and you can always find all of our previous podcasts on our YouTube channel. So we thank you, and we hope that you have a wonderful rest of your day. Bye-bye.
Thanks so much, everyone. Bye.